Hey everyone, welcome back to Part 8 of our ICD-10 CM Chapter 15 Training Explainer. Today, we're really putting a magnifying glass on a highly scrutinized area of medical coding, facility delivery encounters. We're talking about the O80 to O82 code range, where precision isn't just preferred, it's absolutely required if you want to pass an audit. Let's get right into it. Okay, let's dive into today's agenda. 1. Delivery encounters overview. 2. Vaginal delivery codes. 3. Cesarean delivery codes. 4. A coding comparative analysis. And 5. Companion coding requirements. Section 1. Delivery encounters overview, the baseline hierarchy. So before we even think about assigning a code, let's ground ourselves in what actually constitutes a delivery encounter. At its core, we're talking specifically about hospital or facility encounters that are strictly for the delivery of a newborn. It's super important to remind ourselves that these specific O codes, O80, O81, and O82, are reserved purely for the delivery event itself. No prenatal visits, no postpartum follow-ups, just the active event of childbirth. Now here's a foundational rule for Chapter 15 that you absolutely cannot ignore. The delivery code must be sequenced first unless it's contraindicated. Generally, this is going to be your principal diagnosis. But, and this is a big but, if the admission was actually for a complication of labor and delivery, say something from the O60 to O77 range like fetal distress or obstructed labor, then that complication code takes the top spot. Those standalone normal delivery codes, they only get to be the principal diagnosis when the encounter is basically entirely uncomplicated. Section 2, Vaginal Delivery Coding, O80 and O81, Criteria. All right, let's shift our focus over to the natural pathway of birth. A vaginal delivery is simply defined as birth through the natural passage, meaning the birth canal. Sounds clinically straightforward, right? Well, fair warning, the coding pathway requires absolutely flawless documentation, and it all depends on exactly how that natural passage was navigated. Think of this like a strict, non-negotiable decision tree checklist for assigning code O80. That's the encounter for a full-term, uncomplicated delivery. You literally need these 4 things to align perfectly. Number 1, a single liveborn. Number 2, it's got to be a normal, spontaneous vertex delivery. Number 3, full-term gestation. And number 4, a complete absence of antepartum, intrapartum, or postpartum complications requiring treatment. If even one single element on this checklist fails, like say it's a twin pregnancy or they had to treat a minor hemorrhage, you cannot use code O80, period. Scratch it off the list. So what happens when nature just needs a little bit of assistance? Well, that's exactly where O81 comes into play. We define this code as a single delivery by forceps and vacuum extraction. Basically, we use O81 specifically when assisted delivery mechanics and instrumentation are brought in to help the baby safely navigate that birth canal. So the really crucial point here is knowing exactly what an auditor is going to be hunting for in a vaginal delivery chart. The documentation essentials have to explicitly state the delivery route. It also needs to specify the labor initiation. Was it spontaneous or was it induced? And if instruments were used, we need the exact instrumentation details. Was it forceps, a vacuum extractor? We need to know. Remember, vague notes almost always lead to denied claims, and nobody wants that. Section 3, Cesarean Delivery Coding, O82 and Operative Rules. Transitioning over into the surgical pathway, let's look at the precise anatomical and clinical definition of a cesarean delivery. This is a birth via surgical incision in the abdominal wall and uterus. And because this is a major operative procedure, your documentation requirements are going to shift pretty significantly from what we just looked at with vaginal deliveries. The primary code we're looking at here is O82, which is an encounter for a cesarean delivery without indication. Now, I really want to clarify the usage constraints on this one. O82 is strictly used for routine or elective procedures where absolutely no underlying medical indications or complications are documented that force the surgery. If the surgery had to happen because of a specific complication, well, you'd code that complication first instead. This specific distinction heavily dictates our coding accuracy, which is exactly why we need to clearly contrast elective versus emergency urgency classifications. An elective cesarean is a planned procedure with no immediate maternal or fetal danger. An emergency cesarean, on the other hand, is an unplanned procedure required because of immediate severe distress or complications. If you're dealing with an emergency, you're almost certainly going to be digging for complication codes from the O60 to O77 range, rather than just slapping on a simple O82. For absolutely any operative delivery, you have to directly validate a few key documentation essentials. First, you need the specific indications, things like malpresentation, placenta previa, or obstructed labor. Next, you need the urgency classification clearly documented. Was it elective or an emergency? And finally, you have got to capture any intraoperative maternal or fetal complications. We're talking hemorrhage, laceration, neonatal distress, the whole shebang. Section 4, Coding Comparative Analysis, Vaginal versus Cesarean. All right, let's build a clearer mental model here so you can immediately spot what might be missing in a patient's chart. Looking at the route, it's pretty simple. Birth canal versus surgical incision. For the codes, your primary standalones are O80 and O81 for vaginal, and O82 for cesarean. When we look at indications, vaginal relies on normal or assisted labor, while cesarean often hinges on complications, like fetal distress or malpresentation. Ultimately, your documentation hunt changes completely depending on which column you're in. You're hunting for instrument types on the vaginal side and specific surgical indications on the cesarean side. Section 5, Companion Coding Requirements, the compliance check. Okay, this right here is where a lot of otherwise perfect coding just completely falls apart. Let me state this firmly for everyone. Mandatory pairing required. Delivery codes literally cannot stand alone. Omitting your companion codes isn't just a mistake, it's a direct compliance violation. Think about it. An O code for delivery tells us how the birth happened, sure, but it doesn't tell us the results or the timeline. It's like having half a puzzle. So here are your non-negotiable rules for pairing. Whenever you use a delivery O code, you have got to pair it with a code from the Z37 series. This indicates the mandatory outcome of delivery, like single live-born or twins, for example. On top of that, you also have to assign a code from the Z3A series. That gives us the mandatory gestational age, specifying the exact weeks of gestation at the exact time of delivery. To really summarize the stakes of this whole explainer, validation is key. A single missing checklist item on an O80 claim or leaving off a Z-code companion automatically equals a failed compliance audit. And this rigorous attention to detail truly matters in your daily practice because it directly impacts your hospital's reimbursement, the integrity of your clinical data, and of course, your overall compliance standing. So I'm going to leave you with one final provocative thought. Have you validated every single element of your delivery encounter documentation today? Seriously, make sure every detail, every instrument, and every single companion code is fully accounted for. Thank you for watching and stay tuned for Part 9. This is Decode Healthcare with Harshal.